our topic is adrenal medullary. Introduction. Adrenaline and noradrenaline is collectively known as catecholamines are key neurotransmitters and hormones that play pivotal roles in the body response to stress and various physiological functions. Produced by the adrenal glands, these compounds are integral components of the flight response, rapidly preparing the body to cope with the challenging situations. While the adrenaline act to increase heart rate, dilate airways, and release energy stores, noradrenaline plays a crucial in regulating blood pressure and maintaining overall physiological arousal. Understanding the function of adrenaline and noradrenaline provides valuable insight into the body adaptive mechanism and its ability to respond effectively to stresses. Thank you.
Today I'm going to present on the structure of adrenal medulla. So the core of adrenal gland is adrenal medulla. The inferior phrenic artery, renal artery, abdominal aorta are the adrenal arteries branch from blood vessels. It supplies blood. The medulla communicate with the rest of the body with the help of the greater splenic nerve. This nerve is a part of the autonomic nervous system. It supplies nerves. So medulla is composed of modified postganglionic neurons called chromaffin cells. When a splenic nerve cells trigger a stress response, chromaffin cells release their granules. This sends adrenaline and noradrenaline into your bloodstream. So that's all from me. Thank you.
So I will be presenting about the adrenal medulla. It is part of the adrenal gland, as you may know. And what is the functions of the adrenal medulla, you would ask? And when you think of adrenal gland, you can also think about adrenaline. And now, yes, you know, adrenaline is a hormone for fight or flight. It is very important when it comes to a dangerous situation. So when like a tiger suddenly appears in front of you, your sympathetic nervous system will trigger your adrenal medulla to secrete adrenaline or noradrenaline, that is also known as epinephrine or norepinephrine. And then your blood sugar will go, your pupils will dilate, your awareness becomes you'll become much more aware, your brain becomes much more aware, and then your breathing, oxygen intake increases, and your blood sugar intake increases. So it's very important for fight or flight. Thank you.
Hello everyone, my name is Aida. So I'll be talking about the deficiency part. Both adrenal and noradrenaline are catecholamines that are produced by the adrenal glands, and the insufficiency is always associated with adrenal medulla diseases. Okay, so for the deficiency part, I'll be talking about the diseases and type of diseases, cause, and also the symptoms. So the first disease will be adrenal insufficiency Addison's disease. This disease is actually characterized by adrenal cortical destruction. It also primarily affects glucocorticoid and mineralocorticoid production. The third one will be it also impacts the adrenal medulla, resulting in adrenaline and noradrenaline insufficiency. The second disease will be congenital adrenal hyperplasia, which is also known as CAH. It disrupts the function of adrenal glands and also disrupts the function or the synthesis of adrenal hormones, which including catecholamines. The third disease will be genetic enzyme diseases. It disrupts the normal conversion of precursor molecules into adrenaline and noradrenaline. The fourth one will be pheochromocytoma. It is called as tumors which originate from the adrenal medulla, resulting in excessive excessive catecholamine production, which includes adrenaline and noradrenaline. Now I'll be talking about the symptoms part. There are many symptoms that an individual undergoes if there are adrenaline and noradrenaline insufficiency hormones in their body. For the first one, it will be fatigue. The second one is impaired heart function. For the impaired heart function, it causes when there's insufficiency, it causes our heart rate to decrease and also compromise cardiac function. The third one will be low blood pressure, which causes us to have dizziness, hypotension. The fourth one will be impaired stress response and impaired ability to cope with stress, which can also cause mental disturbance, depressions, anxiety, and so on when we have insufficiency of these hormones. These are some of the symptoms. Okay, the next one will be poor blood sugar regulation. This is because we will have difficulties in regulating or controlling the blood sugar level, which means hypoglycemia. The last one will be cold extremities, which means our hand, our feet, everything will be feeling very cold, like very cold. It's like ice, even when we are in a hot sun also.
There are several diagnoses that can be done to detect the diseases related to adrenomedullary, which are MIBG imaging, blood catecholamine test, bone marrow aspiration, genetic testing, blood test, ACTH stimulation test, and also adrenal venous sampling. It is done to check whether our adrenal glands and pituitary glands are normal. This test is done to measure how well the adrenal glands respond to adrenocorticotropic hormone, the ACTH, that is produced in the pituitary gland. It stimulates the adrenal gland to release a hormone called cortisol. During the beginning stage, saliva tests, blood tests, and also urine tests are done before proceeding to the main diagnosis. Imaging tests such as CT scan, MRI tests, and also nuclear imaging tests are also done.
So I'm going to explain about the treatments for the diseases that were stated just now. Since some of the diseases are caused by tumors and eventually will cause cancer, they all have the same treatments. The first treatment, which is successful 90% of the time, is through surgery. This surgery is a procedure to remove a tumor or remove adrenal glands with a tumor. If both of your adrenal glands were removed, you need lifelong hormone therapy to replace hormones made by your adrenal glands. And if the tumor cannot be completely removed with surgery, radiation therapy and chemotherapy are recommended after surgery to destroy the remaining cancer cells. The radiation therapy uses high energy particles or waves such as X-rays or gamma rays to destroy cells, while the chemotherapy will destroy them through drugs. There's also therapy such as targeted therapy, ablation therapy, and immunotherapy, which is mainly used to treat neuroblastoma. All of this therapy will destroy the cancer cell or any abnormal cells to different ways.
To conclude this presentation, I would like to tell that both noradrenaline and adrenaline hormones plays a very important role in the adrenal glands for the body's response towards harmful situation and also hazard. Deficiencies in these hormones, which are frequently associated with disorders affecting the adrenal medulla, can cause weariness, can cause a lot of symptoms like weariness, dizziness, and decreased stress. Although deficiencies are uncommon and not a big thing, they can be caused by a variety of genetic diseases, tumors, and also autoimmune diseases. Adrenaline and noradrenaline deficit require proper diagnosis and treatment, which includes hormone including therapy, to manage symptoms and enhance a very healthy life. Thank you.